Module 15, Preparation for Competition. What nutritional factors potentially affect performance? Well, we know that low or depleted glycogen stores will lead to decrements in performance, as we talked about in Module 8. We know that if the athlete has hypoglycemia, so low blood glucose concentrations, then that's going to lead to a poor performance. We know that the central fatigue theory could possibly play a role, as we saw in Module 8. Dehydration can play a role, as we saw in Module 12. Hyponatremia, having low blood levels of sodium in blood, as we saw in Module 12, as well as gastrointestinal discomfort and upset. All of these could potentially spell decrements in performance for the athlete. What is the glycemic index? Well, the glycemic index is a ranking of carbohydrate foods based upon their postprandial rise in blood glucose concentrations compared with a reference food, usually glucose or white bread. So basically what you do is you eat 50 grams of a food and measure the glucose response over the course of 2 hours to that particular food. So the diagrams down here at the bottom of the screen show two different types of food. So on the y-axis we have the change in blood glucose, and on the x-axis we have our time in hours. So we're going out to 2 hours. So this particular food, which given the picture back here was probably some sort of bread that was given, you can see that over the course of 2 hours, blood glucose spiked up very, very rapidly at about 30 minutes and then came down over the course of 2 hours quite rapidly. Whereas the figure on the right-hand side here, so it looks like we were consuming some lentils. On the y-axis, we've got change in blood glucose, and on the x-axis, we have the time in hours. And basically what you see is you see a slow rise in glucose and then a steady decline over the course of 2 hours. So the food item on the left here had a very high glycemic index because there was a large spike in glucose concentrations, whereas the figure on the right here, this particular food item, there was a much lower rise in blood glucose. So the equation for this to determine the glucose or the glycemic index, is to take your test food of blood glucose, so whatever food you're trying to test and evaluate, and divide that by your reference food, which again is either glucose or white bread, and then multiply that by 100, and that gives you the glycemic index. So the categories here, as far as the glycemic index are concerned, your reference food gets a value of 100. So foods that have a high glycemic index, so they cause a really large spike in glucose in the blood, those are greater than 85. So a moderate glycemic index, that would be anywhere from 60 to 85. And a low glycemic index is less than 60. So the higher the glycemic index, the greater the amount of glucose that was dumped into the bloodstream as a result of that particular food. This is a table showing you the high, moderate, and low glycemic index of a variety of foods. And one of the things that I want to point out here is that with some of the high glycemic index foods, so for example, things like raisins and potatoes, that are coming from foods that are whole, so they're not really processed foods, get a very high glycemic index. And then when you come down here to something like ice cream, which has been mechanically manipulated, and in this example they're using a low-fat example, but that has a moderate glycemic index food. And the reason why I bring this up is because you do have individuals that will use the glycemic index food sort of in a manipulative kind of way. So you've got some foods that might actually register as a low glycemic index food, but we wouldn't necessarily want to overconsume those particular foods because they're not considered healthy. For example, like the ice cream, whereas you've got substances like potatoes that have some benefit and have phytochemicals and whatnot in them, that just because they're a high glycemic index food, people start avoiding them. Carrots are another good example of this. But this doesn't mean that we should exclude these foods just because they're a high glycemic index. It just means that for this given theory of the glycemic index, as we'll talk about a little bit more, that perhaps these foods aren't the best at that given time for preparing for competition. Now, some of the limitations of the glycemic index that we should be aware of. Number one, the type of carbohydrate is very, very important. So what happens is that you get foods that are classified as the same type of carbohydrate, but then they end up having very different glycemic responses, as I just indicated using the table there. So, for example, russet potatoes and corn are both polysaccharides, both the same kind of carbohydrates, but yet russet potatoes will have a high GI and corn is going to have a moderate glycemic index. So they're both polysaccharides, yet we're getting different responses as far as the spike in glucose is concerned over the course of 2 hours. Simple and complex carbohydrates cannot be categorized very rudimentary into low or high glycemic index foods. It's just not realistic. So not all simple carbohydrates are going to give you a high glycemic index. You're going to get a lot of variability. It's all over the place. So some complex carbohydrates actually have a high glycemic index. So it breaks down in that regard in trying to oversimplify the categorization of foods just based on their glycemic index. Fiber is not considered here, and fiber, any kind of fiber that's present, is actually going to slow digestion. So that's going to slow down the rate of appearance of glucose in the bloodstream. So again, using the glycemic index in the presence of a mixed meal perhaps may not be the best way to go about measuring how that particular food is going to affect an athlete prior to competition. As far as protein and fat are concerned, these do not have GI rankings, and again, I can't stress this enough, we are eating mixed meals. We're not simply just eating a potato, or we're not simply just eating corn. We eat a variety of foods. So this is going to affect the way that the glycemic index responds. So it's a bit of an oversimplification, although I do like the principle and concept. As far as the form that the food is found in, we have liquid food versus solid food. This is going to make a difference. In general, the liquid version of the food is actually going to absorb quicker, so that's going to have a different response as far as the glycemic index is concerned. The meal timing is important. Again, those food combinations are so critical to understanding how a food is going to affect the glycemic index. The overall total carbohydrate that's consumed is also going to have an effect. Remember, with the test food versus the reference food, we're only looking at 50 grams. So what if somebody has less? What if somebody has more? That's going to affect the way that you're going to get a GI response. The other issue here is that the glycemic index hasn't been determined for all foods. And the glycemic index really isn't available to a lot of consumers. You really have to dig to find information on this and educate yourself in order to utilize the glycemic index. So the bottom line here is I like the idea of the glycemic index, but we really need to be aware of the limitations of the glycemic index and then use it in a more intelligent way. And we also need to look at more research in this area to figure out all these little intricacies of the glycemic index before we start applying it to the masses. So some special notes as far as the kinetics, that is how glucose appears, so the rate of appearance and the rate of disappearance. Those are important factors in looking at kinetics, the movement of glucose, the shifting of glucose around. When you take a look at this, and I've kind of already highlighted this and discussed this problem, but a high glycemic index food like corn flakes compared with a low glycemic index like bran cereal, the bran cereal actually resulted in a lower glucose concentration, so we would expect that with a low glycemic index food. But here's the interesting part. The rate of glucose appearance was not different between these two types of food. So in other words, the absorption of that glucose was exactly the same. There was no difference. So the bran cereal results in a higher insulin and faster glucose uptake rate is basically what this comes down to. So insulin release was much higher, and then that's going to cause a faster uptake of glucose. So the rate of appearance then of that glucose doesn't change between these two foods. So that's going to explain the lower blood glucose concentrations. So that's kind of an interesting thing to look at, and it definitely shows the complication that we can run into with the glycemic index and the interpretation of the results. So we really need to study this more before we start actually using it and applying it to the masses. So what is the glycemic load? This is an attempt to essentially take the glycemic index and take into consideration the number of carbohydrate grams per serving, because we're not all going to eat 50 grams exactly of a particular food item or a particular carbohydrate item. We're going to eat variations of this, and so the glycemic load tries to compensate for this particular variation in the amount of carbohydrate that people eat. So we're looking at the overall effect of the carbohydrate intake, not just the carbohydrate content. So again, this is kind of in its infancy. There's a pretty decent amount of work out in the literature in the glycemic load, but again, it's something that's not practical or available to everyone just yet. Here's a table that includes both the glycemic index as well as the glycemic load that you may want to take a look at, and checking out the different responses for a variety of foods. Will consuming low glycemic index foods pre-exercise improve my exercise performance? So in other words, can I consume low glycemic index foods and improve my performance? This is what's known as the low glycemic index foods theory. So basically what we're trying to do is maintain blood glucose levels during exercise, keep them more stable. So if we can keep them constant and steady and not have sudden decreases in blood glucose, that's going to spell better performance for the athlete. So we keep those increases in blood glucose pretty even-keeled, as well as insulin. This will reduce our carbohydrate oxidation and hopefully increase free fatty acid concentration, which then would spell a sparing of muscle glycogen, which if we can spare muscle glycogen, then we can prolong the time until we end up being fatigued as a result of glycogen depletion. So we're trying to prolong this time to exhaustion, which can result from negating the typical hormonal effects, so from high insulin release and then getting that sudden drop in glucose, which would then also reduce the amount of free fatty acid concentrations. If we're unable to consume carbohydrate during prolonged exercise, by consuming low glycemic index foods, we may actually promote a more sustained release of carbohydrate through exercise. So in theory, by having the low glycemic index foods available, we're not getting these huge spikes in glucose, and if we can't consume glucose during a race, then we can actually sustain better levels of glucose in the blood because of the low glycemic response of that particular food item. Currently, however, there isn't any overwhelming scientific evidence that we're going to get universal benefit from doing some of these things. In fact, most of the studies aren't supporting this theory. So we do need to look at this more closely before we can make some concrete recommendations for the athlete. As far as what I would recommend is that in reality here, what we want to try to do really is just balance the athlete's food likings, so making sure that the food that's available, the athlete does enjoy consuming them, that there is an availability of choices so they can choose from a variety of foods and not just have one food item, or maybe they do like that kind of thing, but choice is usually better. And we most importantly want to minimize gastrointestinal discomfort. That's really what's more important here. What should my pre-event meal look like? About 1 to 4 hours pre-event consist of? Well, as we have seen in Module 8, we want to emphasize carbohydrate-rich meals because we know there is a relationship between muscle glycogen and exercise performance. We want to maintain those muscle levels and liver levels of glycogen, particularly for endurance athletes, perhaps benefiting from low index foods. You could always experiment with this. Again, the literature is a little bit lacking in this area and hasn't supported this theory, but it doesn't hurt to try. We want to emphasize low fat, low fiber, and low moderate protein nutrients in our pre-meal because of the fact that we want to make sure that we don't have any gastrointestinal upset. So you don't want to have this really heavy protein and fat-laden meal and very rich in fiber simply because it's going to be slower to absorb. And when the athlete starts exercising, there's going to be a competition of blood or for blood between muscle tissue and the gastrointestinal tract. So we don't want to divert blood flow away from the GI tract and then have that food sitting in the athlete's stomach, and that's going to cause gastrointestinal tract upset. As far as differences among liquid meals and drinks and bars, well, if you have an athlete that is kind of nervous before an event or there's an uncertain timetable, then this may be a better way to go. Also, in sports where the aesthetic of the athlete is important, so for example, like dance competition or gymnastics, where it's important to keep a flat stomach in the eyes of the judges, then having a liquid meal might actually offset some of the increase or expansion in the stomach and the GI tract that you get with a regular whole meal. We want to make sure that we do prevent hunger. That's important. A hungry athlete is going to perform less optimally, but we also want to, again, avoid that gastrointestinal upset. And I can't say this enough, the individualization of the diet is so important because we want to make sure that the food that the athlete is consuming is to their liking because that's going to affect their psychology. We want to also avoid any superstitions that the athlete might have because, again, that's going to affect the psychology and could then end up imparting a placebo effect on their performance. So individualizing the plan is very, very important. We also want to ensure good hydration, so making sure that the athlete is hydrated and practicing our fluid plan, as we talked in a previous chapter. And also important here, determining the comfort of the pre-event meal. And we want to do this ahead of the competition. So we want to practice our meal consumption on a day other than race day. That is not the time to try and experiment with new foods or trying something different. We want to practice this ahead of time so that if there are any side effects from doing whatever dietary regimen that you've tried, that it's not going to affect the exercise performance on competition day. Is it true that carbohydrate intake 1 hour prior to exercise reduces performance? You do hear this from some people, and there is some truth to it. We have a small percentage of athletes that actually will respond negatively to carbohydrate feedings. So you'll actually get an exaggerated carbohydrate oxidation, which means that you're going to utilize that carbohydrate much faster than another individual, which means that you get a decrease in blood glucose concentration at the beginning of exercise. That would lead to rapid onset of fatigue. And they'll also manifest symptoms of hypoglycemia. So this is actually what's happening here. We've got reactive hypoglycemia occurring. So we eat the carbohydrate, we get this exaggerated increase in carbohydrate oxidation, and then that's going to cause low blood glucose levels. There's no known explanation for this, but the good news is that if we've practiced our diet plan ahead of time, ahead of the race, that we can easily identify this particular population and then do some preventative action. So what we'll do is, number one, we're going to experiment with the critical time before the exercise where carbohydrate should be avoided. So you're going to have to experiment a little bit and figure out the timing of things and how far in between carbohydrate feeding and exercise are we going to need in order to avoid this problem. There needs to be a substantial amount of carbohydrate consumed, so greater than 1 to 2 grams per kilogram of carbohydrate, in order to figure this out. We would like to choose low glycemic index carbohydrate-rich foods to help with this issue, and we also actually want to include high-intensity sprints during the warm-up. The reason for this is that it's actually going to stimulate hepatic glucose output, so you'll actually perform liver glycogenolysis and release some of that glucose that was stored in the liver out into the bloodstream, and so that will help pad some of the glucose in the bloodstream and offset some of this effect. As well as consuming carbohydrate during the event would all be important preventative measures that we want to take in this particular athletic population.